And as we start climbing this mountain, we look out on the landscape and we see a crisis in the world today. Prior to the pandemic, mental and substance use disorders affected about 1 billion people on the planet. Rates are even higher now. Mental disorders are now the leading causes of disease, burden, and disability in the United States and throughout the world. The problem is not access to care, although that is a problem. The problem is that our treatments fail to work for far too many people. Why can't we do better? What's the problem? The problem is that nobody can answer this fairly simple question. What exactly causes mental illness? All we know are risk factors. And these risk factors get lumped into the biopsychosocial model. We say that there are biological factors, things like neurotransmitters, genetics, hormones, and inflammation. There are psychological and social factors, things like trauma, neglect, poverty, loneliness, that all come together to cause mental illness in different people in different ways, around different diagnoses. But how do these fit together? Nobody knows. Now I want to climb this mountain a little more so that maybe we can start to get some perspective on that question and the answers that can maybe broaden our view and lead to new treatments. And I want to start with correlations. Correlations don't prove causation, but we have very strong correlational evidence, decades if not centuries of this evidence, linking what we call mental illness with all of the disorders on the right-hand side of this slide. Obesity, diabetes, cardiovascular disease, Alzheimer's disease, and epilepsy. For example, people with chronic serious mental disorders, 2 to 3 times the rates of obesity and diabetes. People with mental illnesses, higher rates of cardiovascular disease. People with depression, about twice as likely to develop Alzheimer's disease. But get this, if you have schizophrenia and live to the relatively young age of 66, you are 20 times more likely to also be diagnosed with Alzheimer's disease or dementia on top of your schizophrenia, 20 times. People with mental disorders are more likely to develop seizures. Elderly people with depression, 6 times more likely than others to develop an unprovoked seizure. But what if we look at it the other way around? People with obesity, 25 to 75% more likely to have a mental illness. People with diabetes, twice as likely to have depression. When that depression occurs, it lasts 4 times longer than it does in people without diabetes. Cardiovascular disease, 3 to 5 times the rates of depression. Alzheimer's disease, almost 100% of Alzheimer's patients will have mental symptoms. Depression, anxiety, agitation, insomnia. 40 to 50% of them will have hallucinations and delusions. These are the hallmark symptoms of what we call schizophrenia. So think about it. If you have schizophrenia, you're 20 times more likely to get Alzheimer's disease by the age of 66. And if you have Alzheimer's disease, there's a 50-50 chance you're going to develop the hallmark symptoms of schizophrenia. We cannot talk about root causes of mental illness without talking about root causes of these other disorders. And in fact, people with mental disorders are aging prematurely and dying early deaths. It has long been known that people with chronic serious mental disorders like chronic depression, bipolar disorder, and schizophrenia have a shortened lifespan, anywhere from 7 to 30 years of lifespan reduction, depending on what study you look at. But in fact, a recent study published in Lancet of a population of over 7 million people tells us something more dire. All of the mental disorders are associated with increased risk of shortened lifespan. This includes ADHD, personality disorders, mild anxiety disorders, depression, all of them. What are they dying of? What are these mentally ill people dying of? Everybody thinks suicide. Oh, those crazy people must be killing themselves. Well, yes, the mentally ill do have higher suicide rates, But in fact, that's not the primary cause of death. They are primarily dying of heart attacks and strokes and diabetes and Alzheimer's disease, but just at a younger age. Why? This hasn't gone unnoticed, folks. World Health Organization issued a report in 2016 to try to answer this question. Why? 1, factors related to the individual's behavior and or his or her disorder. The mentally ill are overeating and under-exercising. It's those pills that we're prescribing. They cause weight gain. So maybe it's not all their fault. But if they tried hard, they would be able to keep the weight off. Problems at the health system level. The mentally ill don't go to their primary care docs and take their statins like good patients should. Wider societal issues. The mentally ill are more likely to be unemployed and poor. And we know that unemployed, poor people live shorter lives on average. So maybe it's just that. At the end of the day, if you really look at these and think about them, it's about blaming the victims. The mentally ill are lazy slobs. They overeat, they under-exercise, and they don't work. They're poor, and they don't go to their doctors like they should, like responsible citizens should. It's their fault. I am here to offer a better answer based on science. I am here to say that mental disorders are in fact metabolic disorders of the brain. And in fact, this is nothing new. This is not about inventing a new theory out of thin air. This is about integrating over a century of scientific evidence. Clinical, epidemiological, basic science, genetic research, neuroimaging research, all of it. When we put it all together, it becomes undeniable that mental disorders are in fact metabolic disorders of the brain. Basic research dates to the 1940s. Diagnoses include depression, anxiety, PTSD, schizophrenia, bipolar, anorexia, alcohol use disorder. What do I mean when I say metabolic problem? I have to go beyond insulin resistance. It's more than insulin resistance. It's about changes in lactate, glucose metabolism. So yes, insulin resistance is part of this, but it's not the whole story. Levels of ATP to ADP in cells, levels of reactive oxygen species, redox markers, levels of NAD to NADH, inflammation, cortisol, brain insulin, and mitochondrial function. And I will talk more about that in a bit.